Many Oklahomans strive to maintain and improve their health, but as we age, there are additional factors that need to be considered. Dr. Andrew Dentino practices geriatric medicine at OU Medicine and recently sat down with the Oklahoman's Melissa Howell to discuss the health of older Oklahomans.
What are the top 3 things that older Oklahomans should do to promote good health?
The first thing is that most older adults, in general, have gone away from the things that some might have done in excess earlier in their lives. So even though it's in the single digits, there are still rare older adults who might still be smoking or engaging in excessive use of alcohol or doing other unsafe things. So for those who are still doing those things which were socially acceptable either when they were a generation younger or a generation earlier in what we know, we really need to do all we can to help them get past those activities in their lives. So interventions may well be appropriate. And it's utterly indicated, as we know now in 2015. But what can we do versus going away from the things that we used to do? Many older adults, albeit with fixed incomes or with the frugality that got them to where they are today, in general tend to have appropriate nutrition, but undernutrition is an issue for older adults. New onset obesity is not something that an older adult tends to acquire. We acquired it middle life. Hence, weight loss in an older adult is always, not sometimes or maybe always, a cause for concern. Always. Therefore, is mom or dad's usual diet that they've acquired over 60, 70, 80 years, and that assuredly isn't going to change at this point, are they getting what they need? Are they cognitively able to make all the purchases they'd made? So what they're eating and how much is the window into how they're doing otherwise. And then thirdly, we have to get out of the chair. Every person, every human, if possible, needs to get up and walk around and move around daily. If we're indoors, if the weather's inclement, too hot in summer, too cold in winter, we need to walk around the house. We need to walk around our room. We need to move our arms. Those 3 things, getting away from the things we used to do that may have been appropriate once upon a time, making sure we're maintaining our weight and getting the nutrition we need, and thirdly, getting up and getting around every single day, every single person.
If an older person is mildly overweight, and should that person continue to try to maintain weight?
Yes. This is unintentional weight loss, which is the cause for concern. Volitional weight loss, which I would submit with an older adult, should always occur under the care of a physician because we reach the point where we are retirement age or 70 or 80. All of our behavioral changes should be in the counsel of a physician. Yes, I'll tell my patients, I'll tell older adults, you can't lose 10 till you lose 1 pound. You can't lose 20 pounds until you lose 1 pound. So, small steps over time are the changes which persist.
Okay.
A behavior which is done 3 weeks in a row becomes part of one's lifestyle. A 1 pound weight loss, which is maintained every month, person wakes up half a year later, they're down 6 pounds. So those things which have been acquired over a lifetime, half a century, 3/4 of a century, should only be changed patiently, persistently, and carefully.
How does lifestyle and temperament, how does that affect your physical health as an older adult?
Oh, sure. The diagnoses we physicians use involve organs like hearts and lungs and other sundry organs. But maybe the real issues are loneliness or boredom or loss of social role or lack of a confidant. So all of these things are social interaction factors which then help our physical being. The older adult who takes the bus, drives, walks to the library and reads a book to a first grader. The older adult who can take a walk with their dog. The older adult who can get to a social center or other place where they can then share interactions, good times, and the physical activity that is involved with us moving is what we must do every day. When we look at studies of people who've reached the age of 100, how would you get to become 100? One of the things invariably that comes to the fore is a confidant, someone I can talk to. Whether it's a blood relative, whether it's a lifelong friend, dare I say in some cases if it's a four-legged friend. If it's my confidant, it's someone who's, or it's something that's there for me. My dog that barks really loudly whenever the crows start to congregate, albeit not an intruder. So, how do we step out? We also know that older adults will confide more in persons who might understand them more. So, if I'm 75, am I going to call my grandson and say, "Sonny, I don't know how to use this Facebook thing, can you help me?" We might get together with others and see how it works at our own pace, at a senior's pace, at a pace that it's okay to make mistakes.
So tell me about the Oklahoma Healthy Aging Initiative.
Sure.
Let's talk about that a little bit.
Yes, please. The Oklahoma Healthy Aging Initiative, or the OHHI, OHHI is a program of the OUHSC, Donald W. Reynolds Department of Geriatric Medicine in the College of Medicine, which is supported in part by the Donald W. Reynolds Foundation. And its mission is to advance the well-being of older Oklahomans. Now, we define Oklahomans as everyone from Broken Bow to Boise City, everyone from Mangum to Miami. So the whole state can be circumscribed by the programs that we are developing, exporting, and showing others how to carry forth into their communities. Our programs are educational in nature, which gets from our mission statement to advance the health, the well-being of older Oklahomans, to our vision statement, which is OHHI should be the resource for older adult care in the state of Oklahoma. We have classes which are in the realm of physical activity. We have Tai Chi and exercise for arthritis, for movement. Some that combine exercise and nutrition. Pragmatic, simple, down-to-earth classes, eat better, move more. Classes that help our coping skills, diabetes self-management, chronic disease self-management. The structure of our OHHI is that here in Oklahoma City, we have a Center for Healthy Aging, as well as in Tulsa, another Center for Healthy Aging, developing centers regionally in Durant, in Enid, in Lawton, so across the state, exporting these sites where we're teaching classes. When one looks at the 1,000 to 10,000 Americans every day who are turning 65, tick, 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 and when we look at the tsunami of resources that shall be required to care for us, how can we equip, as well as empower and engage and sensitize the next generation to want to be the caregiver workforce to care for us?
Is there anything else you think that you'd like to add that we haven't covered?
Everyone has a story to tell. When we can get older adults to tell their stories, we learn so much about them. what their wishes are, and how we can be of service and help. The Oklahoma Healthy Aging Initiative, the OHHI, is a series of programs for older adults, physical, social, mental health, programs for caregivers, programs for healthcare professionals, and resources for the state that in the years to come we can help improve the health care of older Oklahomans.
Good deal. Thank you so much.
Thank you for your time.